So now, how can public health strategies be used to eliminate or eradicate a communicable disease? Starting off, in 1976, the successful eradication of smallpox marked a major milestone. It was caused by a DNA virus, and through global vaccination efforts, it became the first human disease to be eradicated. Polio is on the brink of being eradicated globally as well, and it's hopeful that we will soon see the international completion of this effort. Smallpox and polio are the only viral diseases that have been successfully targeted for eradication to date. The first successful vaccine against smallpox was developed by William Jenner in the 18th century, and he achieved this by using cowpox sores to immunize people. While we have been successful in eradicating certain viral diseases like smallpox and making strides with polio, bacterial diseases like tuberculosis and parasitic diseases have not come close to eradication. And the reasons include factors like the complexity of diseases, difficulty in developing effective vaccines, and challenges in ensuring consistent vaccination coverage, especially in the high-risk populations. All right, so now kind of playing on the last slide about disease eradication, what we have here are the ideal characteristics, which are no animal reservoir, short persistence in the environment, absence of long-term carrier states, disease produces long-term immunity, vaccination produces long-term immunity, herd immunity protects those who are susceptible, and it's an easily identifiable disease, and effective post-exposure vaccination. So we're going to do smallpox are the examples for all of these. So for first off, smallpox is exclusively human disease, which meant that once it was eliminated in humans, there was no animal reservoir to harbor the virus. This made it possible to completely eradicate it. So if the disease is eliminated in humans, there's no place for it to run or hide and return later. Then for the second characteristic, the virus had a short persistence in the environment, meaning it couldn't survive long outside the human host. This meant that it could not easily spread through the environment, such as say droplets from coughing or sneezing, unless there was direct contact. Human contact, I should say. Now, we're going to be combining 3 and 4 here. So once someone recovered from smallpox, they no longer carry the virus or can transmit it to others, and they remain to reinfection. So, absence of long-term carrier state and disease produces long-term immunity after recovery, which made second infections extremely rare. Then for 5 and 6, vaccination also produced a long-term immunity, which was crucial in protecting larger populations over time. So there, long-term immunity from vaccinations, and then the herd immunity protects those who are susceptible. Then 7, the classic presentation of smallpox was easy to recognize, even for the average person, which made it easy to diagnose and quickly prevent the spread to others. So that's one of the characteristics there. And then finally, post-exposure vaccination was effective in preventing disease. And this was a key factor in controlling smallpox. Now, a strategy called ring vaccination was used, which involved identifying a case of smallpox, vaccinating the individual in their household, expanding the vaccination effort to anyone in close proximity, typically within a 1-mile radius, and then searching for more cases within a 10-mile radius of the initial case. So these ideal characteristics made smallpox eradicatable, but not all diseases have all these features. While they are ideal, some characteristics might be missing, and the more characteristics that are lacking, the more difficult it is to eradicate a disease. All right, so now what I have here is table 7.4, which outlines the key characteristics of smallpox and compares them to polio and HIV in terms of what makes eradication possible. So as you can see, smallpox has all the ideal characteristics that make eradication feasible, while polio and HIV have some limitations that make eradication more challenging. So you can see just how a couple of no's and some buts make complete eradication of polio much more difficult than smallpox, and how much longer it's taken to get there. Now, in contrast, HIV presents even more challenges. There are no effective post-exposure vaccination, and the virus can be present in people for long periods without symptoms, making it much harder to identify and treat earlier. Plus, there is a long-term carrier state in many cases, and the virus can persist even with treatment. So this is why something like HIV/AIDS eradication is not coming anytime soon, and why polio eradication has taken much longer than smallpox, despite all the progress made. But we can use these ideal characteristics to see which diseases we have the greatest likelihood of eradicating. Alright, so next up we have the steps in a pandemic prevention framework, courtesy of Figure 7.1, which provides a structured approach for developing prevention and response strategies. The framework consists of 5 consecutive steps. First off, there's detecting. You identify the initial case, often referred to as the index case, or at least the early cases. And this is crucial for triggering the response early, and earlier the better. Next up, we have controlling. Isolate the initial cases and quarantine contacts through contact tracing. This step aims to prevent further spread by controlling exposure. Then there's mitigating. Once transmission becomes widespread, mitigation aims to reduce the amount of transmission. And this can be done by physically separating individuals with the disease from others, such as social distancing, lockdowns, or isolations. Then there's immunizing. So immunity can be acquired through passive immunity, so through antibodies, vaccination, or active infection, which may lead to natural immunity. Then finally, there's monitoring, which is ongoing surveillance is crucial to detect new or mutated cases. This helps assess the potential for eradication or elimination of the disease. And as you can see, it's more of a circular path. The pandemic prevention framework is dynamic. As the pandemic evolves and new waves emerge, often mutations or spread to new areas, the framework may need to be recycled to address the ongoing challenges. All right, so now what are we consider the big three communicable diseases going on worldwide? Because now, while COVID-19 has dominated attention in recent years, it's important not to forget the big three communicable diseases, which have historically been the leading causes of death worldwide. And these diseases continue to have a significant global impact in the 21st century. So first off, we have HIV/AIDS. Approximately 2.5 million people have become infected with HIV in recent years. Next up, we have tuberculosis, where around 8 million people are infected with tuberculosis each year. Then we have malaria, where an estimated 200 million people develop the symptoms of malaria annually, which results in over 5 million deaths each year. And these diseases remain a critical global health issue, even with the focus on COVID-19. Going on to the diseases themselves, so with human immunodeficiency virus, or HIV, it attacks the immune system, which weakens the body's ability to fight infections and diseases. Then, if left untreated, HIV can lead to acquired immunodeficiency syndrome, or AIDS, which is the final stage of HIV infection, where the immune system is severely damaged. HIV is primarily spread through blood, semen, vaginal fluids, and breast milk. Without the effective treatment, it can be fatal. But antiretroviral therapy has greatly improved the life expectancy of those living with HIV. But so as you can see, with the weakened immune system, it can still cause great harm. Then for tuberculosis, it's a bacterial infection that primarily affects the lungs, but can also impact the other parts of the body. Tuberculosis is spread through the air when an infected person coughs or sneezes. While it can be treated with antibiotics, the rise of drug-resistant TB strains makes it a persistent global health challenge. Tuberculosis is particularly dangerous for those with a weakened immune system, such as individuals with HIV/AIDS. You kind of see those two can play into each other. Then for malaria, it's a parasitic disease transmitted by the Anopheles mosquitoes that carry the Plasmodium parasite. Here it can cause fever, chills, and flu-like symptoms. Now, left untreated, malaria can lead to severe illness and even death. It is prevalent in tropical regions, particularly in sub-Saharan Africa. Malaria is preventable through the use of insecticide-treated bed nets, anti-malarial drugs, and vaccinations. But as you can still see, they can still cause great problems for everyone. All right, so now touching on one of the big three, HIV and AIDS, so what can be done to address this? So HIV/AIDS is a uniquely challenging epidemic to control due to the nature of the virus. Understanding its biology is crucial in addressing the spread. So in terms of biology, HIV attacks the very cells that are designed to fight infections. It can avoid detection by residing inside a cell and not replicating immediately. Most treatments work by interrupting the replication process, but these drugs aren't effective if the virus temporarily stops replicating, which can make it harder to target. HIV also establishes a long-term carrier state, meaning it remains in the body for a long time, maintaining the potential for continued infectivity. And the high mutation rates of the virus reduce the effectiveness of treatment. Now, despite these challenges, significant progress has been made in reducing the load of the virus through drug treatment and prevent transmission through a variety of public health interventions. So we know we have transmission through blood, which here HIV is most infectious when it's transmitted through the blood, so maybe such as blood transfusions. Now, this was a major route of transmission in the early years, but testing blood supplies has helped reduce this risk. Now, one of the other transmissions is sexual transmission. So, HIV is more infectious through anal sex, which is why early on it was labeled as a homosexual disease. However, heterosexual transmission is now the main route of infection. Then next up we have what we call the maternal to child transmission. Because in the past, maternal to child transmission was common but not 100% guaranteed. But with drug treatment during pregnancy, this form of transmission is now close to being eliminated. However, up to 25% of HIV positive women can still transmit HIV through breastfeeding. Then there's also transmission through needles. HIV can also be transmitted via contaminated needles, which is a concern for both healthcare workers and individuals who inject drugs. The issue can be addressed by better needle technologies and improved disposal methods. Now, up next for our big three is tuberculosis, so its history and its current impact. So the history of tuberculosis dates back to ancient times, but between the 1700s and 1900s, it was responsible for approximately 1 billion deaths, bringing it to the center stage in Europe and America as a major public health issue. At the time of Robert Koch's discovery of the TB bacillus, the annual death toll was around 7 million people worldwide. Now, the TB bacilli are a contributory cause of the disease, but they are not sufficient on their own to cause illness. So we see that many people harbor TB without showing symptoms. Now, other factors such as reduced immunity due to either poor nutrition or other conditions play a critical role in the development of active TB. This is why the disease was often linked with poverty and poor living conditions. And this is why the sanatorium movement involved isolating TB victims while providing good nutrition and clean air. Now, after the sanatorium movement, the next breakthrough came with the development of modern diagnostic and treatment tools. So today we still use the BCG vaccine, BPD vaccine, and chest x-rays as essential tools in TB diagnosis and prevention. Now, for new methods for diagnosing TB, they are improving, such as blood tests that could eventually replace the older PPD tests, making the diagnosis come faster and more accurate. We also have improved epidemiology. A better understanding of the TB spread led to the pasteurization of milk, which nearly eliminated TB from the milk supply. It was a simple but highly effective public health measure. Now, continuing on with the history of tuberculosis, once it was brought under control in the late 1950s and 60s, there was a general loss of interest in the disease. Screening and treatment programs were gradually cut back, and TB was seen as a treatable disease, managed through routine medical care. Now, due to this perception, research into tuberculosis declined, and many thought it was well on its way to being eradicated. However, tuberculosis was prematurely counted as dead. It was never fully under control, particularly in developing countries, where an estimated 33% of individuals harbor the TB bacillus. This means while many people may not show symptoms, the disease can still multiply and spread in the future. Now, after the AIDS epidemic in the 1980s, many patients who had latent TB saw the disease become active again, and it spread easily to others. HIV weakened the immune system, making individuals more susceptible to active TB, and thus TB returned with a vengeance. Now, the development of drug resistance also became a major issue as well. TB is now resistant to multiple drugs, which complicates treatment worldwide. Now, to address this, directly observed treatment was introduced, which ensured that the patients were observed while taking their medication. This ensured adherence to the full course of treatment, reducing the risk of drug resistance by making sure that patients didn't skip doses. However, despite current progress with DOT, drug-resistant TB has become more widespread due to limited research and poor adherence to treatment in some regions. Today, coordinated efforts between public health agencies and the medical community are essential to control the spread of TB. This includes implementing better testing methods like blood tests and more effective treatment options for drug-resistant TB. All right, and finally now for last of the big three, malaria. So why is it so important globally, and what is being done to reduce its death toll? While malaria is rare in the US today, as it is confined to tropical areas with high year-round temperatures, so for instance Florida and Louisiana, globally, sub-Saharan Africa sees the highest burden of malaria, and there are 200 million cases annually, resulting in over 400,000 deaths worldwide. This disease is particularly deadly for children under 5 and pregnant women, who are especially vulnerable. Now, some of the strategies used to reduce malaria's death toll. First up, we have what we call drug-impregnated bed nets. One of the most effective interventions in reducing malaria transmission has been used widespread across the globe. Now, these have helped prevent mosquito bites, significantly reducing the incidence of malaria in many areas. Then there's also a malaria vaccine. So now the World Health Organization, or WHO, recommends the malaria vaccine for areas with high and moderate levels of malaria. This vaccine, although not perfect, is a critical step reducing malaria transmission in endemic regions. And that is all for this lecture. Thank you all for your time.